Yeah. So good evening, everyone. So exam is over, and we are here to have a quick recap of the things what happened in the day. And I have the privilege of having Dr. Khaleel sir, Dr. Priyansh Jain sir, and I think more faculty will be joining gradually. Uh, First of all, must tell everyone that the day has ended now, and you need to take some rest because it has been exhausting for last couple of months for you. This session is just to have a overall idea about what the exam was, what was the uh, overall feeling of the examination. But at the same time, please, you a lot of you will be traveling back to their respective cities, and please just keep it little lighter for next couple of days. Keep listening to us because we are just going to have subject recall also gradually. But Khalil sir, at the outset, what is your overall viewpoint about the day? How did the exam go for the students, sir?
Yes, sir. Sir, I think it was a moderate exam, and students in the paper one they were finding it a bit of moderate paper, but paper two heavily OBG and doable questions on OBG, and there was a lot of questions on ophthalmology also this time, and ENT also had a lot of weightage. So I think it is a moderate paper, and I'm hoping that the percentage or pass percentage will also be on the similar lines as last time. And overall I feel people who have studied properly and not just based on PYQs or PYTs, people who have actually done a proper reading, a conceptual reading, they should be very much benefited in this exam, sir.
Absolutely. Welcome, Nadeem sir. Thank you for joining. And uh, the I would agree, Khalil sir, that paper was moderate and it was a conceptual paper and similar expected topics, but in little like tricky way they asked. And I think if we just happen recall the INICT recall this time also, sir. INI recall was also like this actually, that the topics were similar but their choices were a little narrowed down and they had different style of asking actually. And I think if a junior is listening to this conversation right now who is preparing for the December or the 2026 examinations, they should know one clear loud message is shortcuts are not working anymore actually. The PYQ based study should be totally discouraged, and we have been telling time and again, each one of us at doctor says that you have to be thorough with your subjects because seniors keep sometimes telling us that okay, this will work, but this paper is clear indication which direction we are going. And if you are feeling that paper was moderate or moderate to tough paper, it is a very clear. And as we have been telling previously also, no paper is easy paper. Yeah, papers are like tricky only, but in the first day it's always feeling like this, that oh my god, paper was very tough, but as days will pass you will recall many questions which you would have done correctly. This has happened last time also when we did a last FMG recall. The first day recall was like, no, it was like very end. But then later on, when the result came, 2 week later, we got a lot of people scoring 200 plus marks. So it is very much clearly indicating that we are on the right path. Do not worry. Just let's really have a like other people also now telling. Welcome, Sandeep sir, and welcome to this session. And Priyansh sir, medicine is always, the bone of contention for all the aspirants actually. Which part dominates in CVS, CNS, hepatology, GIT? What is your take on that?
Exact recall is yet to come, sir. And as far as overall paper was concerned, what I feel is कि sir जब exams से बाहर आते हैं ना, they tends to remember more difficult questions because they have read it multiple times in the exam. The ones they were easy, they directly read it, they directly ticked it. So we don't remember those questions in the initial phase, but later on when the recall will start coming in 2 3 days, I feel that it was the paper which earlier was also at the same level which they are asking. But yes, one thing was very rightly said. The options were very narrowed down. Both pass no options. They, if you know the things thoroughly, definitely you can take it. Otherwise, just by doing superficial one liner reading is not going to work anymore. And as far as medicine is concerned, the majority of the part is always going to be cardiology, and This is how it was.
Yeah, yeah, yeah. Yeah, students were writing that this time, hepatology, GIT was actually taking the center stage. But as you were saying rightly, that, like we always remember the difficult ones first, actually, and later on when the recall come properly. And this is again a very initial, recall. Uh, yeah, the next is like we would like to know image-based question. Like, was it like a dominating factor this time? Nadeem sir, what is your take on this image-based question? Were there many, or what is your first collection from
Sir,
students?
good evening, sir. First of all, actually, I got the information from the so many students. I got the call also. So some students were actually crying. ठीक है सर ये रियल है तो like only some of them yes but they said कि most of the questions were clinically integrated and big questions were there so they were not able to solve the questions on time. Some students have left few questions also like so they could not manage the time, right? Last time which for last 6 months sir we have been training all the students that you have to be ready for because like in the last time sir like on 12th January exam approximately 260 questions were all big questions the last time. That is the last time hardly 30 to 40 questions were one liner. So same thing this time also I would say that this was somewhat similar to January exam. And this time sir psychiatry questions were less like even forensic medicine questions were less but most of the question I think most of the students are saying कि sir ophtha questions were so many ophthalmology. So I think so this time ratio of asking the questions were different. Like even ENT questions were also actually easy, sir. This time they have asked. Yeah, but like surgery question and pharmacology question, they said, sir, it was somewhat difficult. So far, this is what I have got to know, sir.
Yes, the gynae and
Ops guy, yeah.
ophthalmology was taking like a lot of
Yes,
question this thing. And I agree with you, sir. That and I again repeat, no paper is easy paper. I'm telling you because when we come out of the hall, we always have this feeling that
true,
like
sir.
hoga ke nahi hoga. But
Mhm.
eventually, as Priyansh also told very clearly, जब recall पूरी तरह बाहर आता है, तो आपको लगता है कि
True.
नहीं ये वाले क्वेश्चन मेरे ठीक हुए हैं. And that's how we actually cross the 150 and very way above 150 also. So let's maintain that. Let us really hear all this conversation, not to create anxiety within you because you guys deserve some mental peace right now. Do not call up any faculty, Nadeem sir, and cry because he will also start crying with you. I know he's very much emotional and sensitive towards you know, and he's a wonderful psychiatry faculty we have. And now, Sandeep sir, pediatric this time also was pretty like dominantly visible in paper two. What's your initial take? Which part of pediatric took the central stage, sir? Neonatology or other things?
Sir, it was a mixed bag. The only change this time was that there were less questions from the malnutrition part. I think even the examiner is now tired of putting questions from malnutrition. So they just changed, but there were expected questions. Short stature, there was a question. And the question was kind of repeat something we already discussed in the class. Some students made conceptual error in that. So what they had mentioned was ratio of upper segment to lower segment they had mentioned as 1 ratio 1.1. Some students read it as 1.1 ratio 1. So if you read it as 1.1 ratio 1, that is, the answer becomes achondroplasia. But 1 ratio 1.1 is nothing but 0.9 ratio 1. If you just do the calculation, calculator is given there, which is a normal thing. And if you take normal, then the constitutional delayed growth was the answer. So many students got it wrong because they said, Sir, wo jaldi mein, we did not see the dot where it was kept. So I would say, sir, overall, from my subject perspective, there were about 25 plus questions last year. This time it was more on the moderate side. It was somewhere between 15 to 20 questions, which is generally the every year trend. And it was 10 to 20% tougher compared to last year. But if somebody has gone through the topics, except for one question, all the remaining questions were from expected topics. And all of them were somewhere, you have read. There was a milestone question. It was a tougher one, but it was a ruling out option kind of a question. There was a photograph shown of a child with hand, foot, mouth disease. You had to mark Coxsackie virus. It's a repeat question. It's a like it has been repeated so many times. There were micronutrient deficiency questions. There were neonatal jaundice question where extrahepatic biliary atresia kind of question was there. Down syndrome was there. Klinefelter syndrome was there. So, sir, If someone has prepared previous year topics and he has read the notes properly and not gone too much into mnemonics, and rectifying the PYQs, I think those students will have a good chance. But my personal take is it was 5 to 10% tougher compared to the January paper, at least in my subject, sir. That is my view.
Wonderful, sir. And I think brick by brick will create the building over there. And all these subjects would be adding on, and they will be taking students way beyond, 160, 170. And, last time also 200 plus scores were too many. But yes, pediatric, I think, would be helping the students to gain that kind of thing. So, radiology, I think images were lesser this time, Dr. Khaleel, sir. What is your information?
Radiology was doable time this time. So they get very standard questions: subarachnoid hemorrhage, uretrocy, ladder head appearance. They gave the identification of navicular bone on the radiological anatomy. And there was a question on radiotherapy asking about linear accelerator producing X-rays. There was a nuclear scan question on DTPA scan that was there. And the blowout fracture, sorry, ENT and radiology, that we get repeat question that we have a teardrop or blowout fracture. Brody's abscess was there on the image based question. So I think but very standard questions. Okay, he did not go into a lot of details. And I think radiology was tested quite significantly, but doable questions this time.
Yeah. Wonderful, sir. But overall, images were lesser this time, I guess.
Yes.
As we used to have a little bit more number of images, but this time images were lesser this time.
True,
And
true.
I just want to give an example. Like how superficial reading is not helping students anymore. If you take some shortcut and you just know the nose in 2.5 hours only, versus if you attend the proper lectures, video lectures or classes, for uncinate process, as you know, actually, like they did not have never asked uncinate process ever in this exam, but this time they were asking about the attachment uncinate process, where it is like in the middle turbinate area. So it means that they want you to know the subject. It's very loud and clear, and students who would have done the main notes and multiple times, they would definitely start getting hint of middle turbinate area will be having the attachment of the uncinate process. So this is what the paper is, and it is not this time trend only. It's a continuing trend for last couple of sessions. Again, Nadeem sir, any information on surgery? How did it go? Like surgery was moderate or?
Sir, so far actually I could not get the question from the surgery, sir. But like as far as I know, some questions were there related to patient management and all. Like as usual, sir, road traffic accident and all. So it was there, but I think we have to wait for the question after that. I think surgery and medicine can be coming up, sir.
Yeah, yeah.
Yes, sir.
These were like that, but gynae was actually
Yes, sir.
but then gynae was doable because our faculty, Dr. Gayatri, I was interacting with, and a lot of questions because we did HIT session this time, high impact training session for FMGE, and a lot of question of ops gynae actually were visible from there only out of her session in HIT, and then of course, but again, HIT or whatever programs we do, they are actually the programs for the quick revision after attending the main classes. Guys, please understand that this is what for the future batches we are saying very clearly, that there is no shortcut to success. Please understand loud and clear. And if you are 2026 aspirant or 2025 December aspirant, please understand that all these sessions are only useful once you have attended the main course over there. Then they are the icing on the cake. But if you do not have the base, you understand that that's a problem. And people must have realized that going PYQ, we have been telling time and again that if you just do PYQs, how would you solve these kind of questions? I did a quick poll on the Instagram channel also. How many PYQs were visible over there? Like only like few people said that yes, PYQs were visible over there, but majority said it was maybe 10-20 questions which were like PYQ style questions actually. So it means that they are asking similar topics, the PYQ topics, or but they are asking integrated manner and in the clinical conceptual manner, and we have to be for the future batches. We are saying that this is also a learning for them also out of this. Sandeep sir, any input from your side about any other thing which you would like to highlight considering this particular examination?
Sir, overall, also I try to talk to across the spectrum students. So, what students generally said was why I say this was a tougher paper. Paper one in January, if everyone recalls, those who have given the exam, and from what we also heard, it was more solvable. And there were a lot of one liners one-liners were there this time also, but it was time management was a problem. I think what Nadeem sir is saying, many students have said the same to me. Time management was a problem for many of the students, those who were on the borderline also, like good students who have prepared well. So time management was a problem in paper one also, not only in paper two. Paper two, if you look at pediatrics, if you look at uh, some of the other subjects like medicine and the integrated part, the questions were slightly on the tougher side. Earlier, they would show the image of gastroschisis and ask you the diagnosis. This time, they were saying gastroschisis and they were expecting you, ki, what is the next step in management? So it's like, moving one step ahead. Next step to be done, what is the best step to be done, what is not likely. Instead of asking one milestone and asking ki, when does it come, they simply said a 9-month child is able to do this and this. Which of the following milestone will be best correlated with this child? And 4 milestones were given. The answer among them was to be reached by ruling out the other options. So it was an option you can't directly mark in the exam. So that is why I say, sir, it was a tougher paper. So even if students are feeling ki unko tough laga hai, I think it was tough for everyone. Some changes which I noticed, optha was a bit more. uh, OBG was maximum. Some students claimed OBG was more than medicine surgery also. Again, we can't really know till the, because medicine surgery is generally integrated. Apart from that, radiology had the maximum weightage among short subjects, followed by significant questions were asked from derma, and few integrated psychiatry questions were also there. Microbiology was there in paper one, but last year there were some questions in paper two. This was not the case this time. There were no microbiology questions in paper two this time. And anat, physio were on the tougher side. Biochemistry, they were quite happy. And those who had done the QRP program, at least one message I'll be sending to Priyansh sir also. So they were quite happy with the QRP videos which sir has said. So I think some of them has commented as well. So I think, sir, overall, this paper exemplifies what we all have been saying since last so many years. Preparing for 3 months, doing PYQ, doing some random either udhar ka classes, doing some, ultra short revision program, remembering the PYQs and sitting in the exam, thinking that you will crack. It's
Yeah.
a touch and for
Yeah.
those who will be preparing again, not this. We do hope that every student who has sit in this exam, they should pass. But for those students who will be sitting in the exam, taking the exam in December and January, it's a wake-up call. Please read conceptually. Please read. Don't just remember the one-liner. Also remember what is the next step in management. Pneumonia question came, but they added one line that the child has not been feeding well since the last 48 hours. Changes the answer. Earlier it was pneumonia. This time it is severe pneumonia. So over to you, sir.
That's great. And we have Dr. Gayatri, ma'am, and welcome, Gayatri, ma'am, for the session. And OBGY
Ma'am's
was
subject is the
yeah, very
I think the
showstopper
common.
man
this
of the
time.
match
Yeah,
of today's exam, man of the match of today's exam,
Yes, sir.
woman of woman of the day today, ma'am. A lot of students
Thank
had a
Gayatri,
very good.
ma'am, I was reading students saying that a lot of question came from your full notes of the classes actually, and it is very good because if such a subject like gynae such kind of subject starts supporting students, people who are standing at the brim actually they're standing on the edge, they start falling on the other side of 150. And Gayatri, ma'am, if I may ask you, what was like more dominant, ops or gynae this in this paper? What?
The majority more questions were from OBS actually, but both were there. And the best part was majority of them were from the class itself. And it was slightly a kind of tricky questions, but most of the expected areas were asked as such. And so many questions were from OBS and Gynae. Till now itself, nearly students have messaged up to 30 questions, which came from OBS and Gynae itself. Some of the questions were slightly tricky, but many of the important areas like partogram or the circlage, so many questions have come from all those areas, sir. But yes,
So
I'm happy with the paper as such.
topics were expected, you mean to say, and the student would be able to score them. And
Yes, sir.
I would request students to comment in the chat box that like what kind of topics were asked in the various subjects, so that we also get an idea. As Gayatri was saying that the ops always is dominantly asked actually, and
Yes.
uh, scoreable question means that yes, definitely when we are worried about the like very high tricky question of ophthalmology, we should be always thinking about the questions of ops gynae also, which will help us pass examination. And Gayatri ma'am, if you can tell gynae which topics were touched this time.
So even the oral contraceptive pills like colorectal cancer, the protection effect as such with this was asked. There was question on the cervical cancer as such. Many questions were and just still
Okay.
like
The gynae also. That's wonderful.
yes
Wonderful.
from
Yes,
Gani as
yes.
well. But majority still I believe it's from more of the ops part which was asked. Till now,
Obstacle.
whatever questions have been shared.
Yes, 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 ma'am. Uh, uh, this is actually something good that with gynae surgery they make the very big chunk. But I have seen that either out of surgery or gynae, one subject is helpful, and other subject will always keep the people on hook over there. So both are not kind actually. Unfortunately, this is like that the trend always it is maintained. I don't know how somehow it is two different subject, but gynae surgery both turning kinder is not really the norm in FMG examination. Nadeem sir, would you agree with that? I guess last like sometimes gynae would be ops gynae is kinder, but surgery will be harsher, and sometimes vice versa like that.
Yes, sir.
Yeah, it's like that. We have Pallavi ma'am over here, our dermatology faculty, and Pallavi ma'am, what questions were asked in dermatology as
So
of now? What you could recall, get to recall?
the
Yes.
questions that I have received. So hello everyone. Hope your exam went well. At least in dermatology, I can say that most of the questions, as expected, were from infections. In fact, all the recalls that I have received till now are from infections, which I always insist is the most important component of dermatology, even more important than the core derma, I would say. And all the 6 recalls till now that I have received is from infections, which is every topic discussed in the classes, in the notes. These are all expected questions, I would say. They are all previous year questions. One of them is a NEET PG recall, also not asked in FMG till now, but it is a NEET PG recall. So that further highlights the importance of doing NEET PG and INI recalls for all the students who are listening to this and they would be attempting further exams. This particular question on leprosy reactions is a NEET PG as well as INI recall, was expected here and it has been asked. And it is the case I've heard in many other subjects as well. That questions from these exams, are recurring in the FMG exam. So that is one highlight of the exam. Otherwise, paper was moderately easy, I would say. Yes, rephrase and twisted, less of PYQs, less of images, but overall dermatology was easy. I hope you all got all the questions correct in derma.
Yes, ma'am. Actually, yeah, dermatology. People saying they were expected actually questions over there.
Yes,
Yes, but
yes, all
images
of them.
were not many this time actually.
Yes,
Yeah,
yes.
but I just want to give one example. Like as you're saying that NEET PG INI questions are spilling over this side. If we remember INI question this time, that fishbone ingestion and getting stuck at piriform sinus, the internal laryngeal nerve got injured. I think the same question came this time again. The fishbone, getting stuck in piriform sinus area. So it means that let us. I always say, and we all say that there's no differentiation of FMG, IMG, NEET PG, FMG, INI-CT. Medical science is a fluid science, and the people would agree with us that we have to be available to know the higher level of data. Okay? Basic understanding is okay, but on top of that, clinical conceptual layering is very, very important. And I think this message should go to juniors very clearly. Please be available for higher level of learning actually, because the examiner is not really having the mindset of differentiating too much into now. See, INI is coming down to NEET PG, FMG is escalating to NEET PG side. So we are merging over there. Please understand.
And
INI is coming, like down to this NEET PG level, and FMG is escalated to NEET PG. So it means that we have to now understand medical science is a fluid science. Let's not create barriers, learn this and that. Yes, there are dominant areas. We understand that. For example, blowout fracture of orbit is always 1 mark. Like always, this Khaleel sir would agree, teardrop sign they always give. So inspiratory stridor, supraglottic obstruction, they will give actually. This is what is always there in FMG. And I think if I remember correctly, there were 2 questions of mucormycosis this time, I think. And mucormycosis, like they asked diagnosis also, they asked the management also. Tracheostomy has been asked every time. They gave 1 question of tracheostomy cuff, the role of that. They gave 1 question about the airway management. We always say that airway management would be asked that if intubation is not possible, what is the next step in management for airway? That was asked actually. And then singer having problem in singing, which nerve got? I think this is a direct question. We know that ELN or SLN injury. I think same question was asked in the NEET PG also, and our FMG, the HAD program, or the even the important question MIQ question we discussed on our channel, the same channel. I think it has that. Otosclerosis is always asked, it in otosclerosis, but this time they asked AS tympanogram. What type of tympanogram it is. So guys, as Gayatri ma'am also told that topics are same, but the language chosen is always going to be tricky, and this is a norm. And we have been telling all of you that this doesn't mean the paper is very 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 harsh. Actually, it is the style of the examiner to ask the same topic in a I always tell Khalil sir in the class also कि patients किताबों से नहीं आते, और जो क्वेश्चन होते हैं वो एग्जैक्टली नोट्स से नहीं होते, नोट्स पे बेस्ड होते हैं, नोट्स की नॉलेज पे बेस पे ऊपर होते हैं, एंड नोट्स बाकी लैंग्वेज विल बिलोंग टू एग्जामिनर. दैट्स व्हाट दे हैव बीन doing it, and this is what. And adenoid adenoid hypertrophy and conductive hearing loss, again the same, like the mouth breathing child, high arch palate. Presbyacusis means that age related hearing loss. They have asked that. It's very clearly indicating that please read main notes and attend the full lectures. This is going to really be helpful for the future batches. For your batch, do not worry. You've done a lot of questions correct. Your brain is reminding you right now what went wrong, but a lot of questions were correct also. Khalil sir, uh, any other information you have after talking to student about other subjects like microbiology, pathology, pharmacology?
Yes, sir. Pharma was tested, a lot of integrated questions with medicine, and I think the important thing is to be able to do all 19 subjects. Like if somebody has only concentrated on PSM and not done optal or not done biochemistry, they all will have this trouble. So it's important to emphasize that all 19 subjects should be done. Don't be selective in your preparation. Don't be superficial in your preparation. You never know which subject gets a lot of weightage in exams, and always the high weight subjects, the OBG, PSM, Optal, ENT. So please do them thoroughly before your exam. And I think, sir, the paper overall looks to be moderate to me. It's not a very difficult paper. Also, somebody who has done a sincere effort should be able to clear with good scores. Also,
Yes. Priyansh, then biochemistry now. Your subject. Biochemistry, how did it go?
Again, sir, it's not having a lot of recalls, but whatever I have got, the paper was not direct biochem questions, but earlier that as they were asking the rate limiting steps, total ATPs, phenylketonuria, such questions were less, but yes, it was quite doable compared to other subject. As the others are saying, Ofta was difficult, this difficult. Biochem was always those who have done it nicely, they get this advantage of these 15 marks. So it's quite doable.
Okay. So you mean to say that, sir, like it was not typical biochemistry this thing, but it was a little last in a different way.
Yes.
That's what the thing
Yes.
is. Yes.
Ji sir. Ji sir.
Okay. Okay, sir. Anyone wants to add anything before we, because
There
this
is
was just
one more
yeah.
observation from my end. This is something I talked to some students also, and many are posting in the comments also. Some students are saying, "Ki, sir, English mein, it was too complicated and we had to read it 2-3 times." Secondly, some students are saying, "Sir, paper was lengthy. We were unable to complete on time." When a couple of students I know personally, when I asked them how many GTs you have given and how many MCQ practice you have done, most of them agreed कि sir उतना GT नहीं दिया. We did not practice enough questions. So this is another one of the missing links in preparation for those who are targeting the December-January exam. If you have given at least 6 to 7 GT and you regularly solve 50 to 100 questions on a daily basis along with theory, then this problem of time management, filtering out the information from a 3 line or 4 line statement, or looking for the words, examiner is not testing your, see, no Shashi Tharoor is sitting over there making your paper. These are all normal people like you and me only, and the English level at NMC and NBE is the same as we people normally do. What might happen is that you have not practiced enough question, or a atypical thing came up your way. If you had done enough practice, that thing would have been taken care of. So this is one area which, again, another, sir, important thing. our brain has a tendency to grasp the negative things. If we marked something immediately, we would not remember it. Because we knew the answer, we marked it immediately. But because there was a tough question in PSM or there was a tough question in Optha, it will stick around in our mind for a longer duration. That's how human mind is. Negative thing stays for a long time. It's like, some couple went to Meghalaya and the lady killed the husband. So not every lady is killing the husband. It's one out of a million people who are they're going to honeymoon and they're coming back alive. Both of them are happy. But we have a tendency to catch hold of the negative thing. So news is operating on the same principle. Our mind also operates on the same principle. So if you have marked the wrong answers wrong, like pedigree was tough, no doubt it was neat INICT level. But again, that is just one of the question. Every exam will have about 50-60 question. They are going to be of super high difficulty level. So what's important is the remaining 240-250 question, what you did in that. And there were enough previous year topics that you could have done. And sir, as Khaleel sir also said, medicine pharma, a lot of integration was there. Even microbiology in paper 2, it was not direct microbiology. It was all medicine integrated, where a organism was being asked. There was another question in pediatrics. I just got it on the message. Complete question came my way. 3-month child, pneumonia diagnosis has been made. They had asked you the most common organism. So pneumonia had 2 questions. So if you are going to FMG exam, not revising pneumonia in the last week in pediatrics, then you are playing with fire. But if you had done it well, not just my subject, any pediatric faculty who's teaching would be teaching you pneumonia. So the important thing is, what was your accuracy in the topic of pneumonia? So it will all eventually come down to your accuracy and ruling out the options. Over to you, sir.
Yes, sir. Sandeep, sir. Absolutely correct. And any final, inputs, Khaleel, sir, from your side, sir?
Yes, sir. Sir, I think this should be used as a platform for students who are going to write in December. Many of these students will be listening to this recall sessions, and one thing is to understand there is a conceptual question papers that are coming in. Avoid getting into the superficial learning or very last minute looks. Be loyal to your main workbooks, main notes, main lectures. Try to see that you can revise your main notes much faster. So the earlier you start, especially how your initial months go on, that will decide in the last phase. If you take care of your initial months properly, this July, August, September students have just come back, they have started to get into the preparation mode. If they sincerely do good work in these 3 months, they'll not have to go to shortcut resources in the last part. The exam is conceptual. Please do not follow very shortcut methods. Use your initial 3 months thoroughly. Do your main notes properly, and then as a revision source, you can go towards the end. So if this 3 months go thoroughly well, I think you are settled for the exam. And the exam is conceptual. You never know which subject will be asked in lot of numbers. So you cannot be choosy and selective in picking up your subjects. Do all 19 subjects. Do all 19 subjects, and at the same time, it is not very vague also. If I see the questions, avascular necrosis, there are a lot of questions, very very straightforward questions. HIV causing pneumocystis, the perihilar opacities. I feel a lot of topics that are being tested are very very routine, that we all discuss in all our regular classes. Somebody who has done this thoroughly in classes, he'll be able to pick up, and your learning style also should be able to pick up these important clinical clues that are discussed. The exam patterns have not drastically changed, but do not go for very very superficial resources. Early 3 months, do your thorough reading, and you should have a good exam in December, sir.
So, but for this batch, definitely we are hoping, we are praying, and we have this confidence that you guys will make it on the other side of 150, way beyond that actually. But this is for the people who are appearing in the December. That's a learning for them. Nadeem sir, what kind of question were asked in psychiatry or forensic? Anything you got to hear from students? Was
Yes,
psychiatry?
psychiatry they have got actually approximately 3 questions from psychopharmacology, sir. Psychopharma 3 questions. So after that, there was a question related to diagnose how to stress. Stress was there. I think one question was related to bipolar. So these are the questions which I have seen so far, sir. Uske baad, sir, I want to add here some points here, na? Because so many students are writing paper aisa tha, waisa tha, language difficult tha. So what I have analyzed about students, sir, starting with now actually the coaching has started for December, for January. Most of the students will be very cool in the beginning phase of the preparation. एंड उनको स्टार्टिंग में क्या लगता है अभी साइकेट्री है, फिजियो है, फार्मा है, माइक्रो है, उसको फिनिश कर लिया, उसको साइड कर देते हैं वो. Ideally, sir, they are not understanding कि भाई physio, anatomy, biochemistry and micro, like and the pathology, ये सब आपके लिए building blocks है, so that you can do well questions in actually surgery, medicine, obs का नहीं समझ ही में नहीं आएगा बाद में. लैंग्वेज वाले जितने भी लोग लिख रहे हो आप ना, आप समझो इस चीज को कि सबसे पहले अनाटमी फिनिश कर लिया, आपने उसको एक सब्जेक्ट की तरह छोड़ दिया पीछे कि भाई खत्म. ऐसा नहीं होता. Whenever you are going to revise your surgery, like suppose if you are learning surgery, a surgery topic like esophagus or the intestine, at the same time you should be revising the anatomy also, same anatomy. जब आप medicine पढ़ रहे हो, please revise your physio, patho, pharma there. जब आप pediatrics पढ़ रहे हो, biochemistry जितने भी inborn error of metabolism है, you have to revise. तो जब तक साथ में लेकर हर सब्जेक्ट को नहीं चलेंगे ना, फिर अब सारे सब्जेक्ट पूरा डिसइंटीग्रेट होता जाएगा सारा का सारा. Right? So I feel कि all of you, like who are going to prepare for the December exam, you are having 5 months. Like first of all, you have to go through all 90 subjects, that too in detail. ठीक है. हर चीज को कितने लोग हिंदी में लिख ले तो वर्ड मीनिंग, भाई हिंदी में एग्जाम नहीं आएगा ना, बाद में उसको हिंदी में पढ़िए, बट यू हैव टू रिवाइज इन द इंग्लिश पैटर्न, क्योंकि अब ये सब चीज भी देखना पड़ेगा. 1 क्वेश्चन 1 मिनट, अगर लेंदी है फिर क्या. आपका प्रैक्टिस ये होना चाहिए कि 1 क्वेश्चन यू हैव टू फिनिश. रीडिंग ऑफ द क्वेश्चन शुड बी कंप्लीटेड इन 15 सेकंड्स. 15 सेकंड्स में सारे ऑप्शन देखिए. नेक्स्ट 15 सेकंड्स में यू शुड बी एबल टू मेक अ डायग्नोसिस. फॉर एवरी क्वेश्चन यू हैव टू सेव 15 सेकंड्स. जब इस तरह का मैनेजमेंट आप स्टार्टिंग से करोगे ना, देन ओनली देयर विल बी प्रोडक्टिविटी. सिंपल वे में चलना है, 5 मंथ्स आ रहे हैं, स्टार्टिंग में 2-3 मंथ्स मस्ती के लिए, लास्ट में 3 मंथ्स हो जाएगा, नहीं होगा. ओनली रैपिड रिविजन, प्लीज नो फुलिशनेस. फ्रॉम स्टार्टिंग प्लीज गो थ्रू द सब्जेक्ट इन डिटेल. जो रैपिड डिवीजन है लास्ट के लिए रखना है. सेम फैकल्टी सबके रैपिड डिवीजन हो जाएगा, तो शॉर्टकट मेथड फॉर एनीवन इट विल नेवर वर्क. दिस टाइम सर ओवरऑल जो एग्जाम का मुझे लग रहा है सर कि आई फील के रिजल्ट विल बी अप्रॉक्सीमेटली इन बिटवीन 18 to 28%. Sir, exam was moderate. So many students would have done great only, sir. Like exam का result sir अच्छा है, क्योंकि अभी ये सब examination room से निकल के आए, सब थोड़े पैनिक जोन में भी है सर. ठीक है सर. तो कितने लोगों का भी ये लग रहा होगा कि अरे मेरा ये क्वेश्चन गलत है, उसका ये सही है, उसका मेरा ये गलत हो गया है. तो आई फील फॉर ऑल ऑफ यू, प्लीज चिल, रिलैक्स. आज किताब उताब बंद कर दो, जाओ सो आराम से. हैं मूवीज आगे, सितारे जमीन पे, और भी F1 अच्छी मूवी आई है अभी.
सैयारा सर,
सैयारा आई है, सब देखो यार तुम. बिरयानी
बहुत ही मतलब दैट इज द काइंड ऑफ मूवी. मतलब वो तेरे नाम जॉनरे का मूवी है, सैड एंडिंग वाला. मेडिसिन भी है सर उसके अंदर थोड़ा सा.
बहुत बढ़िया सर,
बहुत क्रिंज है और अच्छा म्यूजिक है. यंग लोग हैं, सो पीपल शुड गो एंड वॉच. इफ दे हैव अ गर्लफ्रेंड बॉयफ्रेंड, दे शुड डेफिनेटली गो. एंड इफ दे आर सिंगल, तो फिर तो बनता है देखना ऐसा मूवी, सैड एंडिंग वाला मूवी, रोमांटिक.
खुशी वाली मूवी देख लेते हैं आज. पंजाबी मूवी
नहीं सर, जहर को जहर से काटेंगे सर
डेफिनेटली. क्योंकि it would be not like yeah people have the choice, but yes, Sahara is a good make. But yeah, you can. Basic thing is that take rest today, and please spend time with your parents if you are in the same town. Plan something for tomorrow. You've done your best. Like now the game is in the already the key is there. You're there to match the key, and yes, they will take a week or 2 weeks to give you the result. But we can't do anything beyond it. Whatever you had to do, you've done that. Now the only thing is either we can just keep on, getting anxious, thinking about, what can go wrong, or we can be hopeful that I think there'll be a lot of hidden questions which will go correct when the key is matched with my actually answers over there. This is what we can do. And Gayatri ma'am, anything from your side to add up for this batch?
Yes, sir. Especially for the next batch who's going for the exam, what I felt is majority of the questions, especially in Obs and Gyne, you will be able to do if you are focusing on the previous year topics from NEET and INI. At least 5 years of NEET INI is done. Like for example, whenever I teach partogram in the class, students पूछते हैं, मैम ये आएंगे, ये तो थोड़ा ज़्यादा level नहीं है, मतलब they always ask that. But the exact question which came previously in the NEET exam, like 3 years back, that got repeated again in the abnormalities of partogram. Such questions, especially majority of the areas, I think they should cover at least 3 to 5 years of previous year questions from NEET as well as INI, because level is that much nowadays. And yes, students are telling the questions, the language of questions was slightly tricky as such. But yes, still, sir, if the areas are thorough, I think it will be okay. And I had just a collection of questions as such from monitoring antenatal surveillance as such. There was nearly 3 questions that were asked. NST from biophysical profile question was there, and even about variable deceleration question was there, sir. And PPH, always we teach about the management algorithm of PPH. Even from there was a question. If already oxytocin and all drugs are tried, what will you do next? Such kind of questions. Especially what I got nearly 2 3 image based questions. One of them was from the circlage. Either McDonald's circlage or Shirodkar circlage was asked. Students are sharing both the images as such related to both of this. So depending on the image, it was either mostly McDonald's circlage which is asked as such. Even there was an image on teratoma which was asked, which is the typical appearance of hair within the ovaries and all those things, that typical image. And that was yet another gynae question that came. Question was there on menopause as well, early menarche, Asherman syndrome. These were few other questions from gynae as such which were asked. And pap smear, always pap smear, cervical screening is a must know as such from gynae. Like majority of these areas which were asked are must know, like the core areas as such. And even from the basics of labor, like from fetal skull, they had asked if it is face presentation, which is the engaging diameter, submendobrachmatic diameter. Such kinds of even direct easy questions were there. Like even in the last exam, there were 2 questions on early pregnancy signs. This time they asked that third sign from early pregnancy sign again. So that areas there is clubbing of question. I still believe like students should focus rather than going through all the questions first. First, I would say give preference to the previous year questions, preferably from NEET and as well as INI exam, because those areas are definitely important, especially in obs and gynae. That's what I have felt in the exam, sir.
Yes, ma'am. They have been making the baby steps towards this particular situation when the exams merge, and though they could not do next, but this is actually the next being camouflaged in all 3 exams. Actually, if you see very carefully, this is what is happening. We are labeling, and I will encourage all the future aspirants, if you are younger chaps over there listening to this conversation for your future 2026 or later examination, please be available for a higher level of learning. Let's not be basic. Let's not be really just doing the basic stuff and go to the exam and hoping that everything will go right, actually. And this will give you definitely, very huge, preparation for the NEET PG, which is future for you after FMG also. I know that not your concern right now. But as Gayatri ma'am is very clearly telling that, the NEET PG INI, and we sell in every class that, okay, when you are having time, do not just do the Q bank. Like our Q bank, actually, if you see in DocTutorials, would be having the questions of NEET PG also, this thing. But yes, we do not want to overburden you also, that we do understand, like subglottic stenosis, the Cotten-Mayo classification, etc. They are typically those side. But within the same topic, if you want a little bit more detail, there's no harm in learning that. We should be available for that. That is what actually were there. So we will be having individual recalls also gradually, but we'll be trying to collect as verified question as possible. Though there will be some errors of recall for sure. Please join this channel for the individual recall by respected faculty members. Gradually, will coming day by day, but whenever you hear any recall, please have this thing very clear that there are some errors in recall for sure. Because when you tell us, ultimately, you tell only 2 choices: the one which you marked and the one which you were confused about. What about the other 2 choices? Nobody knows actually. That's why there is a disparity between the recall-based assessment versus the real assessment actually. So do not really have that, and creating undue anxiety would not help. The key has been set by NB already, and your answer have been logged by NB now. Only thing is that to run a software to, the match, the whole thing over there, and then give you the result. So unnecessary, troubling yourself is not going to help. Just stay relaxed and stay hopeful, and just spend some quality time and watch Sayara as advised by Sandeep sir, and learn some central nervous system in more detail over there probably. Or if you want to really be a little light, I would suggest some Punjabi movies which are dubbed in Hindi also. Like that can be done. Or go out, like there is some restaurant waiting for you for last so many months which you passed across, and you say, no, I'm going to resist. I will never enter the restaurant till my exam is over. So exam is over now. And I think before exam also, preparation is always having this feeling, I could have done better. And after exam, the feeling is always like that, I could have done better. So it's okay. But within this feeling only, the people pass actually. So let's have that kind of genuine, hope to pass the examination. We all pray for you. Each and every faculty member and teammate in doctorals, we are actually very much, in love with you. We are very much like concerned about your well-being. And that's what, like the evolution of QBank in doctorals and the bringing of the QRP 5.0 videos, if you see very carefully. And each and every faculty member has put heart and soul into preparing those videos. Why? Because what we really want is that, like the content should be comprehensive yet concise. This is what our theme line is. Our central theme of the whole content is like that. We should not lose upon the data, but we should not say that in so many words, but that they cannot be revised 3 times by the student. This is what, like the new QRP evolution 5.0 is, and the V5 is also same about that. And for the future batches I'm talking about, there's, choose your things very carefully, because without 3-time revision of the proper content, we start losing the, data on the exam day. This is what. And for this batch, which has finished the exam today, and let us call it a day, and let us just relax peacefully and just be at ease, and let us pray for us to pass, for our friends to pass also. Any final input from anyone side? Priyansh sir, Nadeem sir, Gayatri ma'am, Sandeep sir, Khaleel sir. Khaleel sir.
I think it is important to be proud of the efforts. I think in all the journey that we have done, okay, many of the students have actually genuinely put in extremely good hard work for the last 6 months. So pat yourself, forget about results, your journey, your effort to keep on fighting till the last day, till the day of exam, right? I think it means a lot. Feel proud of whatever good efforts that you have done, and stay hopeful, and hopefully, you will have good results also. So at the same time, I want you to, appreciate all these efforts, all the consistency that you have done, and we are, each one of us is very proud about your efforts here. Yes.
Please say something which will help the students. They should not cry anymore.
See, sir, whatever had to happen has happened. Answers are locked. Now it is time for students to indulge themselves. 2 suggestions. If they cannot go out, they don't want to watch Sayara or some Punjabi movie, there is a cheaper alternative also. Uh, Look at, if you are already committed, look at the photograph of your, talk to him or her. If you're a single person, either girl or boy, doesn't matter. There is a beautiful song I heard today only. It's Together by Shubh. Even if you don't know Punjabi, just turn it on. Lights on the lower side. Have a good plate of biryani and some sweets. Turn off the light. Have a look at the photograph of your crush. Check out his or her profile with that song playing in the background, and drift off. You'll thank me later.
What the recipe
You can
is.
easily, search it on the YouTube.
All ingredients explained very properly. I like the details you have really given. And Nadeem sir,
Options should be there. Na?
no,
These
see,
things should be
guys,
coming from Nadeem sir, but
idea,
I'm doing Nadeem sir's work here.
yeah, idea here is to keep you guys chilled out, because stress would be definitely not helping us anymore. And you guys have done your bit over there. We know it. You have wasted certain number of days. We all also know that, because we have also been students sometime. You know it. We know what goes on the student life. सास भी कभी बहू थी. We remember that. Like हमने भी वो सब किया हुआ है. उसके बिना भी ऐसा नहीं कि सब perfect होने पे perfect result आते हैं. थोड़ा बहुत दाएं बाएं होता है. Nadeem sir, your inputs, nobody should cry.
नहीं अब एग्जाम खत्म, मैच इज ओवर नाउ, सब भूल जाओ, आप जाओ घर जाओ, सुकून से रहो, सब खत्म अब.
Saas Bhi Kabhi Bahu Thi Part 2 is releasing day after tomorrow. Students, if they want to, if they have those likings, they can always catch up.
Sandeep sir, you will open your OTT platform, I guess.
Sir.
Yes. Nadeem sir, thank you very much for your wishes. Gayatri ma'am, anything final from your side? Any inputs?
The same thing as you all mentioned, sir. I feel now what is done is done. It's time to relax. Don't think about any questions that went wrong, because whenever we think, we only remember those questions that went wrong. Okay? अभी आराम से घर जाओ, जैसा सर ने बताया, अच्छी तरह खाना खाओ, मूवी देखो और बस मजा करो. अभी कुछ मत सोचना, ठीक है? Let the result come. Enjoy your 2 weeks thoroughly. Yes, still there.
Priyansh Jain sir.
Sir, mitti dalo, aage badho. It's done, and right now many recalls will come, many things will come, and at times what happens is by whenever you will discuss the question with your friends, what happened, we just discuss the difficult question, the tricky questions, and we feel very bad that we have marked this or that. So don't worry about that. We tends to not remember the easy questions, and they you have marked it correct. So let's wait for the result, and you have done your hard work. Let's enjoy, and ऊपर वाला सब देख रहा था, आपकी मेहनत देखी है, and it is going to happen. So wishing you all the best for your good results.
Wonderful, sir. So, guys, I will close this session by saying one thing. If you're worried about what you did not know and what was tricky in the paper, think about what Khaleel sir said. Expected radiology questions, like, like identifying a bone in the foot X-ray. Remember that thing. What Sandeep sir said, that there were many questions which were doable in pediatric, like, Down syndrome or Klinefelter syndrome. What Gayatri ma'am said, that a lot of questions were there from offside which were doable, and gynae also. Nadeem sir also told that there was some question of psychopharmacology which were manageable, and same with Priyansh sir. And out of ENT, I can just enumerate to remind you, you could have done certainly those questions right, most probably, like type A stimenogram in otosclerosis, inspiratory stridor, supraglottic obstruction, Singer, which nerve involved, ELN, uncinate process location, middle turbinate, tracheostomy, 2 questions, mucormycosis, 2 questions, adenoid conductive hearing loss scenario, presbyocusis, piriform sinus fishbone infection question, etc. These are first few recalls only. But look at these questions of different subjects which faculties are telling you. Remember those questions also. They must have gone right over there and create a genuine hope that I think we are very much deserving that we should pass the examination and stay a little bit, relaxed. Do not be creating undue anxiety for yourself. And, let's not really, but yes, whenever you're free, you can come back to this channel. We will be having individual recall by all these respected faculty members, and that definitely give you more idea about the question which were asked. So thank you, respected faculty members, for sparing this time and guiding the students for the overall theme. But we agree it was a moderate to little moderately difficult paper. It was conceptually intense paper. We agree to that, and this is what the last time paper was also like this only in the first reaction actually. So we wish each and every one, we pray for your success, not just the faculty team. The whole teammates are praying for your success, and just stay hopeful about the outcome. This is what we have launched, the V5 version. The new version is there for the future batches. This is new videos for the FMGE. Okay? And of course, with the QRP videos of 5.0, and then the QBank also is revamped. And this is for the future batches, not for you guys. Okay. So the whole team will take your leave now. Thank you very much, everyone. And again, we wish you all good luck and best wishes for the good results you have. We're looking forward to conduct interviews for you. Don't worry, we're waiting on this channel to host you.
Best wishes, everybody.
Thank you very much.
All the best. All the best, everyone.
Best wishes.
All the best.